Brianna Sykes, and this is my health assessment for Maryville University. This is Brandon, and he has volunteered to be our patient for our assessment. Before we came back to the room, I had him empty his bladder. I did a full set of vital signs, checked his height and weight, and assessed his far-sighted vision using the Snellen chart. And then while he was walking back to the room, I went ahead and assessed his gait and balance, which was all normal. And then once we got back here, I had him change into a gown, and I washed my hands, and we're now ready for our physical assessment. So I'm going to start out by inspecting the scalp and just assessing, making sure that everything looks normocephalic, which it does, and then I will palpate the scalp. I'll feel the hair while I'm doing it, checking for any tenderness or nodules, masses, making sure that the scalp is freely movable from the skull, which it is. Everything feels good. I'm also checking hair distribution and looking for any alopecia. And then from there, I'm just going to assess the skin on the face, look for any rashes or any redness, places that look like they don't belong there. So while I'm doing that, I'll notice a scar on his right temporal region. Otherwise, everything looks pretty normal. I'm going to palpate all the facial bones and just make sure that there's no tenderness over the facial bones. I'm going to palpate the temporomandibular joint, so I'll have you open and close your mouth. And I'm feeling for any clicks or pain when he does that, which there were no clicks noted, so that's normal. From there, we're going to move on to the assessment of the eyes. I'm going to assess them for symmetry to make sure. I'm going to look at the external structures, look at his eyebrows, make sure that they're full, that they're growing normal. Look at his eyelashes and make sure that they're growing in an outward direction, which they are. Everything looks normal. I will assess his sclera, make sure that it's white, that there isn't any excessive redness or jaundice. From there, I'm going to palpate the lacrimal apparatus as well as look at his conjunctiva and make sure that it is pink and moist, that there's no tenderness to palpation, which it is pink and moist. And while I'm here and palpating up here, I'm going to go ahead and check and palpate my sinuses. So we'll do the frontal and the maxillary. Just make sure that there's no fullness, that he doesn't have tenderness to palpation, that you don't feel any excessive fluid in any of those areas, which I do not. So while we're at the eyes, I'm going to use my pen light and assess his pupillary reaction. So while I'm having him look straight forward, I'm going to look in each pupil for the direct as well as the consensual and the consensual. And then go ahead and go back to this one, look at the consensual. And those are both good. I'm going to check his cardinal field of vision, so I'll have him follow the light with only his eyes and make sure that there's no nystagmus, that there's no bouncing, that he's able to track and focus well in all directions, which he is. And then while we're there, I'll go ahead and have him do the cover and uncover test, staring straight ahead and have you focus on an object, and then go ahead and uncover, and do it with the opposite eye as well. Good, and then uncover. So we're just looking to make sure that both eyes focus well, that he doesn't have any problems adjusting once his hands are moved, and that the covered eye stays focused on the object as well with no bouncing, which everything was normal for the assessment. After the eyes, we're going to go ahead and look at the nose. First, we'll just look at it straight on, make sure that it's midline, that there doesn't seem to be any outward signs of deviation, which there do not, and that there aren't any structures on the outside. From there, we're going to look at the interior structures. We're going to have you look up and look at the septum, make sure that there's no deviation, which there is not. I'm going to check for any polyps as well, and that we'll look at all the hair distribution, make sure that it's normal, and that all is. So from there, and the turbinates, which are all normal. From there, we're going to look at the mouth, first assessing the external structures, the lips, make sure that they're pink, that they're moist. You don't want to make sure there's any cracking, that there's any lesions or paleness noted, which there are none. So from there, we're going to go to the internal structures, making sure that we get a good view of everything. First, I'll just have you open your mouth wide for me. We're going to look at the top and the bottom, the hard and soft palates, as well as the buccal mucosa, which all looks good. The anterolateral or anterior-posterior pillars, which are in place, as well as the tonsils and the uvula. Make sure that it's freely hanging and it is a single uvula. I'm going to look at his teeth, Look at the color and indentation of those. Make sure that they are all in place and that the quantity is as they should be. From there, I'm going to have you stick your tongue out and move that from side to side. I'll examine the lateral borders of the tongue, and then if you can touch the roof of your mouth, look at the bottom. That is a common place for oral cancer, so it's very important that you examine the bottom of the tongue. And then I will also check a gag reflex as well as the ah reflex. So if you can stick your tongue out and say ah for me. Good. And you're just looking that the uvula bounces, and then a gag reflex, which is intact. So everything there seems to look normal. And while we're there, I'm going to go ahead and check some of my cranial nerves because a lot of them involve the mouth. So I'll have you go ahead and stick your tongue out for me and smile, puff your cheeks up, and grit your teeth. And then if you could close your eyes real tight and then wrinkle your forehead up. Forehead. There you go. And all of that seems to be intact. I'm going to have you swallow. Good. And then while he's there, I'll go ahead and have him shrug his shoulders and just test the strength of those. Also part of your cranial nerve exam. So from there, we're going to move on and examine the ears. First, we'll just check to make sure that they are symmetrical bilaterally and that they look the same on each side, which is due. So I'm going to just kind of palpate the outer surface, checking for any nodules, lesions, anything that doesn't look like it should be there, as well as palpate his tragus and the pinna, make sure that those are not tender at all to touch. And then I'm going to go ahead and examine both of his tympanic membranes using the otoscope and make sure that they're kind of a pearly white, that there's not any excessive fluid in there or excessive wax, which is not noted on either side. You want to check, make sure there's no redness or any bubbling that looks like it could be kind of fluid behind the membranes, which he does not have. And so from there, we're going to palpate his nodes while we're up there. Make sure that they are not firm, that they're not tender, that they're not swollen, and that there's no warmth or redness over any of them, which there should not be. So we're going to start with the preauricular and the postauricular. Go back to the occipital, and then the tonsillar, up to the submandibular, and then we're going to do the superficial cervical chain, as well as the posterior cervical chain, the deep cervical chain, the submental, and the subclavicular. And then I'll have you kind of move your arms out for me. We're going to check the axillary nodes for any swelling. There's none noted. You want to be cautious, especially if you notice any swollen lymph nodes that are not painful, because that could definitely be a sign of a malignant process. So while I was palpating all those, none of them were swollen. So we're going to move on to the neck and just do an assessment, make sure that we don't note any JVD and that the trachea is midline, which is the case. So go ahead and palpate. You're going to palpate the trachea, make sure that it feels midline, that there's no tenderness noted, and then I'll check for his thyroid, and then I'll have you swallow. Good. And it goes up when I anchor it, so everything feels good there. I'm going to palpate both carotid arteries separately and make sure that they are normal, that they are equal bilaterally, and they are. And then last, I'm going to auscultate for any bruise in the carotid arteries. So I'll have you lift your head up and hold your breath. Listen over the carotids. And then I'm going to have you take a breath and do the same on the opposite. And there are no bruise noted. So from there, we're going to move down to the chest. First, you're just going to do a visual inspection. You would normally have them disrobed and just do a formal assessment, checking for any heaves or pulsations in the chest. Check that their respiratory rate is even, that they don't have any accessory muscle use, and everything looks good here. So then I'm going to palpate for any heaves, pulsations, any tenderness. I'm going to feel the apical pulse. and everything feels good, the point of maximal impulse, and everything there looks good, I'm going to first listen for heart tones in over all of the valves. We'll start with aortic, pulmonic, Erb's point, tricuspid, and mitral. Noting S1 and S2 heart sounds, I did not hear an S3 or an S4. I also did not hear any murmurs, clicks, gallops, or rubs. So everything there sounded normal. From there, I'm going to go to the lung fields. I will percuss across bilaterally, just listening for a resonant sound that should come from the lungs. And you'll go all the way across. Those are resonant. You're listening for any hyperresonance that could indicate air, such as in a pneumo or emphysema, or in dullness, which could indicate pneumonia or atelectasis. I did not hear any of those. They were resonant as they should be. So I'm then going to listen to breath sounds and auscultate those. I will do that in a symmetrical pattern from the tops all the way to the bases. And then I'm also going to have you put your arms out, and we'll also listen to the lateral sides of both lungs. I did not hear any adventitious breath sounds. You're listening for them to be clear throughout, but anything abnormal could be crackles, rails, rhonchi, or wheezes, which I did not hear any of. So from there, I'm going to have him turn around, and we'll also do a posterior exam. Spin all the way around.
Okay.
We're going to do a posterior exam of all the lung fields, as well as we're going to inspect it visually, make sure that we don't see anything on the skin that shouldn't be there, any rashes or lesions as well. You're going to note any moles and their appearance, making sure that they have regular borders, which he does not have anything worrisome. So from there, you can percuss across the lung fields, listening for hyperresonance, or for resonance, making sure that there is no hyperresonance or dullness. She has none. Making sure that there's no pain to percussion. And then from there, we're going to auscultate his breath sounds on the posterior aspect, also starting at the top and working to the bases in a symmetrical fashion, and always ensuring that you do it bilateral. We're going to percuss over the kidneys. There should be a dullness noted because that's a solid organ. And then while we're on the posterior aspect, we will percuss for diaphragmatic excursion. So I'm going to have you kind of cross your arms over, you kind of lean down, take a big deep breath and hold it. And then you'll percuss and wait for the sound change, which is right there to where it turns into a resonance. And then I'll have him blow all that air out. And remembering where that is, percuss down for my sound change, which is right there, which is normal. You want that to be about 6 to 12 centimeters, and so his is perfect. And it should be the same on both sides. While you're here, you can check to make sure his excursion is equal. I'll have him take a big deep breath. Make sure your thumbs go out equally and then back in as he exhales. And that is all correct. So I will then have him go ahead and lay down for me. We'll go ahead and start with the abdominal assessment. So first we're just going to do a visual assessment and make sure that everything looks normal, that I don't see any pulsations, that everything is equal. And then we'll kind of start with a light palpation and just kind of feel for any masses, anything abnormal, making sure that he doesn't have any tenderness to any of that. And then I'm going to auscultate vowel sounds in all 4 quadrants. Normal vowel sounds are heard. It's important to note that if you don't hear vowel sounds, that you have to listen to each quadrant for up to 5 minutes for them to be considered absent. Otherwise, they could just be hypoactive because you do need to let your stethoscope sit there for the full 5 minutes. While we're auscultating, we're going to auscultate the arteries and make sure that there are no bruits heard in the abdominal portion. So first we're going to start with the aortic, and then the renal arteries, as well as the iliac, and the femoral. No bruits were heard. From there, we're going to move on to deep palpation. So first I'll just palpate using deep palpation all the way in all 4 quadrants, making sure that no tenderness or no masses are felt. And then I'm going to check to palpate the liver borders. I'll have him take a big deep breath. I am not able to feel the liver borders, which is not abnormal in a normal person. And then on the other side, I'm going to palpate using deep palpation for the spleen. I as well do not feel the spleen. Typically in an adult or in any person, you're not going to feel the spleen unless splenomegaly is present. So that is not abnormal. You can percuss the solid organs and you should hear dullness over them. I'm also going to percuss the liver borders. So we'll start out just percussing. Until you hear that change to dullness, to remember where that's at, and then go from the bottom up. And percussing his liver borders, which they are within normal distance. However, you cannot palpate them. That's completely normal. So from there, I'll have you go ahead and sit back up and spin around. I'm going to check the strength in his shoulders as well as in his neck. So I'll have you kind of shrug your shoulders for me. Good. And then have you shrug against me. Good. And can you move your head and all of... Good. And over to the other side and forward. That's good. Now we'll have you push against my hand. And back and forward. Good. His range of motion is intact for all planes, as well as the strength is equal in all directions. While we're here, we're going to go ahead and do the hearing test. So first I'm going to start out with just the whisper test. I'll go behind him. I'm going to have him cover one of his ears and whisper a word, and then I'll have him repeat it. Orange. Go ahead and repeat it.
Orange.
And then the other ear. Red. Go ahead and repeat it.
Red.
Good, so that's intact. We are going to use the tuning fork and check the Weber test. So I'm going to hit this and put it in the middle of your head. I'll have you tell me if you hear it in the right ear, the left ear, or both.
Both.
Good. And then, so that is intact. We want them to hear that in both. Next, we're going to check the Rhine test. I'll hit it. We're going to put it on his mastoid process, and then I'll have him tell me when he cannot hear it anymore. And then from there, we'll move on to air conduction with the same test.
I can't hear it anymore.
And tell me when you can't hear it.
I can't hear it anymore.
Good. So that is a normal Rhine test. You want them that tested the bone and the air conduction. and you're going to want it to, the air conduction to be double the time of the bone conduction. So that was good. From there, we're going to check the extremities, and starting with the upper extremities, just looking at hair distribution as well as color and temperature, making sure that they're warm and pink. And then we'll go ahead and check the brachial as well as the radial pulses while we're here, which those are all equal and strong, as well as skin is pink and warm. I'll also check cap refill, which is less than 3 seconds, and then look for any clubbing, which there's slight clubbing on all digits. And while I'm up here, I'm going to check his reflexes. Go ahead and check brachial, as well as radial. Brachial over here, and radial. And then we're going to move down to the lower extremities. We're going to check as well hair distribution, color, temperature. Going to make sure that there's no edema noted, which he does not have. Skin is warm. While I'm here, I'm going to check his popliteal pulses. Bilaterally, they are equal and strong, as well as his dorsalis pedis. Good. And those are also equal and strong. And then the posterior tibials are equal. I will check his sensation in his lower extremities. So I'm just going to have you tell me if it's dull or if it's sharp. And close your eyes.
Sharp.
Good. And here.
Dull.
And here.
Sharp.
Good. Here.
Dull.
And
Sharp.
good. So sensation is intact all throughout bilaterally. So then I'm just going to have him stand up and do an exam of his spine. Just have you kind of face that way for me. I'm going to first palpate the cervical spine, checking for any tenderness, onto the thoracic, and then the lumbar. And then I will have him bend forward. And from there, I'm going to check for symmetry, make sure that there is no curving, and look for any kyphosis or lordosis, which I see none. So that concludes the physical assessment, and thank you.